Copyright disclaimer under Section 107 of the Copyright Act 1976. Allowance is made for fair use for purposes such as criticism, comment, news reporting, scholarship, and research. Fair use is a use permitted by copyright statute that might otherwise be infringing. Nonprofit, educational, or personal use tips the balance in favor of fair use.
1,000 CDC employees were just laid off, and here's what no one's saying clearly enough. These were decisions, not forced shutdown furloughs.
We acting like getting a job is so easy when there's been people that's been applying for years.
Administration started laying off thousands of federal workers.
Things are going to get bad.
35,000 jobs within 2 months. Have a job. I suggest you hold on to that thing because the job market right now is the worst that we've seen in a very, very long time.
Something weird is happening.
What's happening is healthcare is going down the drain. That's why I advise healthcare workers to have a plan. So a lot of hospitals, it's possible. Why? Because they're going to feel the grunt of Medicare and Medicaid no longer having funding. So what happens when a patient comes to a hospital and they have a 10-day stay and their stay is $50,000, their insurance covers it. So what happens when someone who was formerly on Medicare or Medicaid or did not have insurance and they were going to be covered on Medicaid comes in and their hospital bill is $50,000? The hospital is going to eat that cost. The hospital cannot continue to eat these costs. They will go broke. And what happens when a hospital goes broke? It will close. Hospitals are businesses. They're built on a business model. It's not for the people. It's for profit. So you might be thinking, oh my God, but my hospital is so needed in this area. Like, they're not going to close. Maybe these other hospitals, but my hospital is so needed. Like, we have 400 beds and it's a level 2 and it saves and cares for all these people. Your hospital is a business. I worked at a business hospital that was needed in the area that it was in. It had hundreds of beds. It was almost always full. The ED was slammed. Like, you would think that this hospital would never close. Oh, it did close. And what you'll see is first they'll close L&D, then they'll close step down. They'll try to reduce the amount of nurses. They'll try to minimize the amount of floors. They're going to put pressure on you nurses to take more and more patients until that place closes. And then what happens when your hospital closes? The other surrounding hospitals feel it. So your ED wait time when you go in as a patient is no longer 10 minutes, it's now 40. And also why? Because a lot of people are not going to be getting primary care. You know how your kid has a little cold and you go to your doctor's office and they prescribe you something or they give you your management and that's that? People are no longer going to go for primary care because they don't have it. They're going to wait until their kid now has a major disease or problem, infection, and now they're in the ED. Things are going to get bad. If you watch this and think, oh, well, I don't work in healthcare, so it's not going to directly affect my job. And then in terms of me, I have a lot of money in insurance. Like, I'm above this. You're not. As healthcare workers, we honor the law. EMTALA, that means we serve anyone and everyone that walks through the doors, regardless of if you have insurance, money, if you're here legally, doesn't matter. We have to help you. So when you walk into that ED wait room and your wait time is 5 hours and you're like, oh my God, but I have money and I have insurance. Like, why aren't they covering me? And a homeless guy walked in and got a turkey sandwich and he said he had chest pain. Like, why is he before me? It's because we prioritize based off of healthcare needs, not money or insurance. So that's not going to matter. So if you sit in that ED waiting room for too long and God forbid something happens because you didn't get care immediately, are you going to care now? I'm not making this video to be dark or like scare anyone. This is just the reality that we're facing. So we might as well all just be aware.
At University of Phoenix,
This is just the reality that we're facing. So we might as well all just be aware.
So on the news yesterday, Jefferson Hospital came out with an announcement. The whole healthcare system, they have about 5 or 6 hospitals that they are laying off between 600 and 700 healthcare workers. There is no specific detail at this time as to what kind of workers those are. They say it makes up about 1% of the workforce. But here is a fun statistic that I actually, of course, I do my research. Do you know the CEO, Dr. Joseph Cacchione, made his salary was $5.38 million. As of 2023. That was his yearly salary. I'm not saying this gentleman doesn't work hard, okay? But I'm looking at what I make and what I know a lot of my friends make that work for Jefferson and similar healthcare fields. And we're the ones doing the care and bringing in the revenue and charging for services to healthcare providers. Those CEOs don't have the blood, sweat, and tears that we are seeing every day. And we're working off, and nothing that we make is reflecting cost of living increases, okay? The fact that most of my friends can't even pay rent or buy a house, okay? So what's wrong with this picture? They have reported, according to this article, a $1.95 million loss as of June 30th. That was the end of their fiscal year of 2025. And the CEO's salary is $5.38 million as of 2023. What's happening? What's going on here? Where's the disconnect? I mean, we all know healthcare is for profit, and that's where the biggest problem is. I've been seeing, the care go downhill so badly. We've been screaming for raises. There are no raises. I haven't had raises in years. So, is anybody else a little disturbed?
Much worse. 35,000 private jobs, y'all. 35,000 private jobs from last month to this month have been lost. If you have a job, I suggest you hold on to that thing, because the job market right now is the worst that we've seen in a very, very long time. When everybody thought things was going up, and people not talking about this, they sweeping this part underneath the rug. And I'm not talking about federal jobs. I'm not talking about all the loss from these federal workers that's going to be furloughed and the others going to be fired due to this government shutdown. I'm talking about just private sector jobs, y'all. Within a month's time, 35,000. Some of the numbers that they put out last month were incorrect, baby. 35,000 jobs within 2 months. Gone. Private jobs. Not to mention all these federal jobs that's about to be lost. So many people furloughed because of the government shutdown. Not to mention some of them are just going to lose their job. Y'all, this is a mess. And when I tell you, this is some of the roughest stuff I've seen in a very long time. And everybody talking about everything that don't matter except what we all should be paying attention to. Stay woke, man. Don't go to sleep. Stay woke. Bye, y'all.
I definitely have